When an abnormality in the breast requires a biopsy, how do you know what tool to use for the job? Let's break it down. In breast imaging, when you come across suspicious calcifications or a suspicious mass, the only way to know what's truly causing this change is a percutaneous core biopsy. With so many different biopsy devices on the market, how do you decide what to use? The first decision is whether to use a spring-loaded device versus a vacuum-assisted device. Next, you need to decide whether to use a throw device or a no-throw device. And lastly, you need to decide the appropriate needle size, often referred to as gauge. When deciding what tool is best for the job, you have two main options. The option on the left is a spring-loaded throw device. You place the needle adjacent to the mass, and when you push the button to deploy, it fires the needle through the mass, acquiring a sample. As opposed to this, a vacuum-assisted device is a no-throw device. You place the needle underneath the mass or area of interest. When you acquire a sample, it closes the trough on the mass, sucking the mass into the trough at that time, but it does not fire or deploy beyond where the needle is located. Which is better, a spring-loaded device or a vacuum-assisted device? They each have their own unique pros and cons. With a spring-loaded device, you can do multiple passes, quickly going in and out and acquiring samples in different areas. Where the vacuum-assisted device, you typically make one pass through the area to acquire your samples. Spring-loaded devices tend to be much quicker, whereas vacuum-assisted devices require more setup. There is less bleeding with a spring-loaded device, and subsequently slightly higher rate of hematomas that occur with a vacuum device. Spring-loaded devices do, however, acquire smaller cores and less tissue than a vacuum device. And lastly, spring-loaded devices tend to be significantly less expensive than vacuum-assisted biopsy devices. Some general rules: spring-loaded devices tend to be best for sonographic masses, whereas vacuum-assisted devices are best for calcifications. Common sizes for spring-loaded devices include a 12-gauge or a 14-gauge needle, whereas vacuum-assisted devices come in 7-gauge, 9-gauge, 11-gauge, or 12-gauge. Spring-loaded devices are the most commonly used devices for an ultrasound core biopsy. They tend to be quick, easy to use, and inexpensive. No-throw devices are particularly good when you're up against an implant or in the axilla or somewhere where you want to make sure you have maximum control of your needle. The vacuum-assisted devices are used most commonly for stereotactic core biopsies or MRI-guided biopsies, however can be used in the setting of a sonographic mass. When performing a breast biopsy, make sure you have the appropriate tool for the job. Thank you for watching. Please click subscribe to see more of our content, or go to MAMMOGUIDE.COM to learn more about breast imaging.